Hello, my name is Adam Pasley, and this is my Nursing of 552 Capstone presentation on improving patient safety during EMS to ED transitions of care through implementation of MIST as a standardized handoff tool at Madison Memorial Hospital. Structured communication tools are crucial for enhancing the accuracy and completeness of information exchange during patient transitions of care, thereby reducing the risks of safety and medical errors. In the high acuity environment of EMS to ED, transfers effective communication is often challenged by distracting injuries, emotional stress, and time pressures. Additional barriers include inconsistent protocols, technological limitations, and interpersonal factors, further compromising the quality of handoffs. The mnemonic, mechanism of injury, medical complaint, injuries/illness, signs/symptoms, and treatment provides a structured framework for patient handoff. However, its impact on communication outcomes and patient safety requires further investigation. The proposed Capstone project will evaluate the implementation of MIST within EMS to ED transitions at Madison Memorial Hospital, assessing its effect on communication fluidity and the incidence of patient safety events. Utilizing validated assessment tools and participant feedback, the study will measure changes in information completeness, timeliness, and accuracy following implementation. The results of this proposed Capstone project are expected to inform evidence-based practices, support transition of care handoff tools, and strengthen interprofessional collaboration in the transfer of care setting. The transition of care between EMS and the emergency department is a critical piece in a patient's care continuum. This is the point where responsibility shifts from EMS to hospital staff, nurses, physicians, and others. It must happen quickly and accurately, often in challenging conditions. In the fast-paced world of acute emergency care, communications can be a struggle during these transitions, frequently strained by task saturation, high mental load, and emotional stress. When information is missed or misunderstood, the risk of patient safety events and medical errors increases, lending to poor outcomes and greater liability. The proposed PICO research question has been applied for this project. An EMS personnel transferring patients to the emergency department at a level 4 trauma center, how does the implementation of a standardized handoff tool such as MIST compare to current unstructured handoff practices, affect the accuracy and completeness of patient information transfer, and reduce communication-related patient safety errors over a 12-week implementation period? The focus of this project is to identify the factors that cause miscommunication during these handoffs and find ways to make the transfer of care process more efficient and reliable, ultimately improving patient outcomes. Medical errors pose serious consequences for patient safety and well-being, but also for the healthcare system as a whole. Nursing frameworks like the AACN Synergy Model, Benner's Novice to Expert Framework, and Donna Bedian's Quality of Care Model all emphasize the importance of providing care that is accurate, timely, and intentional. Medical errors and malpractice are estimated to cost U.S. healthcare systems between $20 to $45 billion every year. One way we can help reduce both harm and cost is by improving communication during transitions of care, particularly in high-pressure settings like EMS to ED handoff. Research on EMS to ED patient handoffs highlight three major themes affecting patient safety: barriers, conflicts in medical practice, and inadequate information. Barriers include interruptions, miscommunication, and clinical or hierarchical constraints. Studies show that structured approaches like team-based reporting, the MIST tool, improve communication and clinical efficiency. Though some gaps in vital signs and treatment reporting remain, conflicts arise from differing professional priorities, with EMS focusing on rapid triage, while ED staff emphasize detailed diagnosis, leading to inconsistent information sharing. Finally, inadequate information during handoffs, such as missing patient demographics, timelines, or ABCDE assessments, contribute to delays, inappropriate care, and extended hospital stays. Overall, the literature strongly supports standardized handoff tools to improve information accuracy, reduce safety risks, and strengthen interprofessional collaboration, although further research is needed to establish best practices. This Capstone project focuses on improving patient handoffs from EMS to the ED at Madison Memorial Hospital in Rexburg, Idaho. The project will implement the MIST handoff tool to standardize communication and improve the accuracy and completeness of information during care transitions. Participants should include paramedics, EMTs, nurses, and ED physicians, all with at least 6 months of clinical experience who are directly involved in the patient transfer process. Stakeholders include EMS agencies, ED leadership, quality assurance teams, and the Institutional Review Board would ensure consistency in training and adherence to policy. The effectiveness will be measured using Likert scales surveys to capture clinician perceptions and the cognitive load inventory for handoffs to assess mental workload during handoffs. The project will be guided by an interprofessional team including EMS personnel, nurses, ED physicians, and quality improvement staff. Collaboration among EMS agencies, including Madison Fire Department, Fremont County Ambulance, and Mud Lake Ambulance, will support standardized protocols and training. This approach aims to enhance communication, reduce errors, and maintain evidence-based practices across the continuum of care. By implementing the MIST standardized handoff tool, it is anticipated that improvements in communication will occur during EMS to ED transitions at Madison Memorial Hospital. I propose that the expected patient information will be completer and more accurate, covering critical details like injury, mechanisms, vital signs, and pre-hospital treatments. I further anticipate staff surveys reflecting increased confidence, better interprofessional trust, and fewer perceived communication barriers. I expect qualitative feedback may show greater satisfaction and clearer role expectations for all members of the transition of care. Additionally, cognitive load for both EMS and ED clinicians is expected to decrease, streamlining the handoff process to be more efficient and less mentally taxing. This project is anticipated to enhance collaboration between EMS agencies and the emergency department, standardizing transitions of care practices, and improving patient safety outcomes. Long-term, these changes aim to support sustained improvement in patient safety, continuity of care, and readiness for future quality improvement initiatives, while contributing to the broader evidence base for structured handoff practices, particularly in rural healthcare settings. Structured communication frameworks are essential for ensuring accurate and complete information during patient transitions. Transitions of care frameworks help to reduce safety risks and medical errors. In EMS to ED transfers, communication is challenged by time pressures, emotional stress, distractions, as well as inconsistent practices or even interpersonal barriers. The MIST mnemonic provides a standardized structured approach to the transition of care process. This study would help to evaluate how implementing MIST affects the accuracy, completeness, and timeliness of communication, and whether it can reduce patient safety events. The results are expected to build on evidence-based practices, standardize handoff protocols, and strengthen interdisciplinary collaboration during critical transitions of care. Thank you for your time and your attention. I look forward to your feedback.